My name is Dudko Alexei, and today we'll talk with you about OSCE exam, case number 4, injuries of ankle joint. So before entering the station, you are reading carefully clinical case. There is information that foot was twisted and the injury occurred in the ankle joint. So that is indirect mechanism. The patient fell down and the ambulance took her to the hospital. So the first medical aid was provided here. So you shouldn't do that. But you should examine the patient, make the diagnosis, and make the treatment. So you are wearing gloves and entering the station. You should present yourself by telling the number from your badge, and then you go directly to the patient. So you ask the patient about the mechanism of injury, and you should tell the examiner that it is indirect mechanism. Then you should start the examination of the ankle joint, and here you can see that there is a deformity. When you are palpating the ankle joint, you can feel the crepitation in the side of medial malleolus and on the other side where there is lateral malleolus. You can feel also mobility of bone fragments. Those are clinical symptoms that are specific for fractures. Patient also can't move the ankle joint, and there is pain, local swelling, and hematoma. So those are general symptoms for fractures. Now you should prescribe an X-ray. So there is an X-ray with your patient, and you should describe anterior-posterior view, which is on left, and lateral view, which is on right. So on the AP view, you see the fracture of lateral malleolus, the fracture of medial malleolus, and you see the talus is displaced to the lateral side. So we have a lateral subluxation of a foot. On the lateral view, we can see that there is a fracture of posterior edge of tibia, and we have a subluxation of foot to the posterior side. That is your final diagnosis. We have a 3 malleolar fracture with a subluxation of foot to the lateral side and posterior side. Now you should tell about the treatment. So the reduction of displacement should be performed in a close way under local anesthesia. After that, a circular plaster bandage is applied involving the foot and up to the knee joint, so above the knee joint. The patient should wear this POP bandage for 3 months, and periodically you should perform X-rays. So the next X-ray you perform just after reduction. Then you should do this in 7 days, then in 1 month, and then in 3 months. If everything is okay, after 3 months in POP bandage, you remove it and patient start rehabilitation. So that's all about this clinical case. Thank you for your attention.